Good morning. This meeting is about proper skilled nursing documentation on Netsmart Devro that contains 7 pages. Today we are going to start with page 1 to discuss the requirements, the necessary requirements for proper and effective documentation for the clinicians on Netsmart and Devro. Starting from page 1. Once you gather and you are ready to start your skill clinician documentation and you have your information, once you gather your clinical information and you are ready to document on Netsmart, starting from page 1, on the particular client, because each client and each case is different, you're gonna document according to the clinical details for each particular client, because each client is different and each case is different. So starting from page 1, for each client, where it's a visit checks and changes since last visit, you have to identify your patient by name, by their name and their date of birth for each client. So you have to click verbalizing that you have identified your patient by their name and their date of birth by clicking on this. You make that clear to anyone who is reading your chart. And for every client, you also have to click on Care Plan Provider Orders Check. That means you reviewed the care plan for that particular client during your shift on each visit. So each visit during your shift, when you are ready to document your clinical information, you have to document that you identified your client by their name and their date of birth, meaning that you are not documenting on the wrong patient or you're not documenting on the wrong client. And you are not providing medical treatment for the wrong patient or the wrong client. So you have to click patient and identify them by their name and by their date of birth. And you also have to document care plan provider orders check, indicating that you have reviewed the care plan and you have reviewed if there are no physician's orders, or if there is not, you have reviewed your care plan during each shift and during each visit, you have reviewed it. So you have to do this on every visit. And for every visit, you have to check safety precautions. Those are your precautions. When you click on safety, that means you are ensuring the patient's safety. You are ensuring the safety of your client. You are making sure during your shift that your client is safe. So that's the safety precautions. And if you have to also click on fall precautions, let's say if the client is not able to walk on their own, they are not able to ambulate on their own. If they use any device for ambulation, like if they use a wheelchair, a walker, or a cane, and they have to ambulate with assistance, you have to click on fall precaution. If they are able to walk on their own and they don't have to use any devices. They don't have to use a wheelchair, a walker, a cane, or whatever, and they are able to walk independently. If they are able to be mobile, they have full mobility, they are able to walk, and their mobility is independent, then you don't have to click on this. If they use any assistive devices like wheelchair, walker, cane, or any standard AFOs, whatever, braces, anything to walk with, then you click on fall precaution. And you click on fall and safety precaution, indicating that you are ensuring that they are safe and that they don't fall during your shift. If the client is eating by mouth, however, they have problems swallowing, they are high risk for choking while they are eating. If they are high risk for choking, and let's say they have an NGT, they have a gastrostomy tube, nasogastric tube, or any tube at all for any tube feeding. And they are also eating by mouth like pureed food, and they are at risk for aspiration because they are on puree or soft diet, then you have to click on aspiration precaution. If they are not at risk for choking, let's say they are not eating by mouth, then you don't have to click on this. Let's say if they are on a regular food and they are able to eat regular food without any difficulty, then you don't have to click on this. If you have a patient who's on a ventilator and has a tracheostomy tube, and they are able to eat by mouth because they have the tracheostomy tube and they are on a ventilator, even though they are able to eat by mouth, you still click on aspiration precaution because of the tracheostomy tube. Because the tracheostomy tube, even though they are able to eat by mouth, put them at risk for aspiration. The only time you don't click on aspiration precaution, meaning during your shift, you are making sure that this patient is safe. They are not gonna aspirate during your shift, is by clicking on this. And this make it clear to everyone who's looking at your chart that you did check on this safety precaution to make sure that your client did not choke. You did your best to make sure your client didn't choke during your visit, during your shift. If they have seizures, they are at high risk for seizures, or they have a diagnosis for a seizure disorder. They have a diagnosis that put them at risk, at a high risk of having seizure episodes. Then you click on seizure, like CP, cerebral palsy, any neurological disorder, brain tumor, any neurological disorder pertaining to neurological will put your client at risk of seizure episodes. And some clients, that's part of their diagnosis, like they have a seizure, they have a seizure disorder. It's either they have a cerebral palsy, CP diagnosis that put them at risk for it, or they already have a diagnosis of seizure episodes or epilepsy. The other name for seizure is epilepsy. If they're at any risk at all of having a seizure episode, and it's part of their clinical data, you have to document. Part of your precaution is seizure precautions, meaning that you are making sure that your client is safe. You are implementing all seizure precaution during your shift. If your client were to have a seizure during your shift, you will ensure that that client is safe during the seizure and after the seizure by clicking on this. You have to click on that. Standard precaution, you have to click on that for every client on each visit, because this is indicating that you are making sure that you do your best practice by implementing your standard precaution. Standard precaution is also the same for universal precautions. This means that you are ensuring proper infection control technique. It implies that you are washing your hands. You are washing your hands during each client contact. You are washing your hands. You are wearing your gloves. If you were to come in contact with any bodily fluids, you are putting on your glove and you are doing frequent hand washing as a part of your infection control. So that way you don't spread infection to the client, to yourself, and other people around you that you come in contact with. That's what this is indicating. You're implementing your standard, your universal precaution for proper infection control technique. So you don't spread infection to yourself, to the clients, and to other people around you. You are doing frequent hand washing and you are wearing your gloves. You are washing your hands before care, before you put on your gloves, and you are washing your hands after patient care, after discarding your gloves. You are washing your hands. And at times it might be necessary if your hands are not grossly soiled, you can use hand sanitizers depending on the procedure that you are performing with the client. You can also use hand sanitizer in between of the washing of your hands for proper infection control. If the client is a respiratory client with any respiratory diagnosis, you have to click on respiratory. That's your ensuring respiratory precautions. Uh, and that's for respiratory. And also if they take medication for respiratory issues or if they have a diagnosis of pertaining to respiratory, you are implementing and you are doing your due diligence to ensure of their respiratory precautions during your shift. Some clients have VP shunt. Not every client has VP shunts. If they have a VP shunt and VP shunts is part of their diagnosis or their medical procedure, you also click on VP shunt. If they don't have that, then you don't have to click on it. If you are not sure if your client has a VP shunt or not, you can always give me a call and I will review the medical records, the service plan, and everything pertaining to the client, and I will let you know whether they have a VP shunt or not. And you can also see it on the clinical when you do your chart review, when you review your care plan, you will see it as part of your care plan. If you don't see it and you want to know, you want to make sure whether they have a VP, give me a call and I find out the information and the details for you in order to ensure proper documentations. So what applies to every patient though is these. You identify your patient by name, you check on the care plan, you review your care plan, you ensure their safety precaution, they are safe, no fall precautions. The only time you don't check on fall precautions is if your client is fully mobile, they have full mobility, they can walk by themselves, they can walk on their own without no or any assistive devices like a wheelchair, cane, or a walker. And you check on standard precaution for everybody. Okay? And you check on whichever one applies in terms of which one is your precautions. So let's say if all of this apply to your client, then we click on all of this. Some clients have emergency equipment in the home. Let's say they're on a ventilator, or if they have a BiPAP, CPAP machine, or if they are a trach patient, if they have emergency equipment in the home, any emergency equipment in the home, you check on this. If this doesn't apply to your client, even sometimes if they have oxygen, you can check on this. Like you check your emergency equipment, you check your oxygen tank, make sure your oxygen tank is full, your oxygen tank is not empty. Because if you check your oxygen tank and it's not full, it is empty, you have to make sure you call the DME supply, and then you'll call the DME supply company so they can send you a new oxygen tank if the client is even on PRN oxygen or continuous oxygen. Every shift, you have to check the O2 tank to make sure your client's tank is full and not empty, whether they are on the oxygen PRN or they are on the oxygen continuously. And then this bag check, go bag check is for ventilator patient mostly. If your client is on a ventilator and they have to have this bag. Okay, and you have to check this bag, making sure this bag is secure and the bag is intact. That's mostly pertain to ventilator patients. And sometimes it can pertain to a BiPAP and CPAP patients because their CPAP and BiPAP machine also has a bag to it. Infection control kit. If your client has an infection control kit in the home, you check on the infection control kit. And this talks about alarms, all alarms on and audible. If your client is on a ventilator has a set alarms on it. And also a pulse ox machine in the home. If they have a pulse ox machine with the ventilator, they have alarm in the ventilator machine. You have to click on this, meaning that all alarms are on and they are audible. You can hear your alarms. Indicate, that's what this indicates. You have to click on this. If it's not a ventilator patient or the patient is not on a continuous pulse ox machine, you don't have to click on this. Even if they're not on a ventilator, if they have a continuous pulse ox machine in the home, you have to click on that. Okay, and if they don't, you don't click on this. If they don't have an infection control kit in the home, you don't click on that. If they're not on a ventilator, CPAP, BiPAP machine, you don't have to click on this bag here. If they don't have emergency equipment check in the home, like an oxygen tank, ventilator, and other machines, they're not on oxygen, you don't have to click on that. However, these, you have to click on these for every visit. If they're not in a seizure epilepsy patient, cerebral palsy patient, you don't have to click on this if they're not at risk for seizures. If they're not at high risk for aspiration, you don't have to click on that. You only click on what pertains to your patients. And like I said, a section of this, you have to click on it on every shift. And one of them is identifying your patient by their name and date of birth, and that you reviewed the care plan. And you click on some safety precautions and standard precaution infection control for each shift. Now, if your patient was hospitalized and unplanned rehospitalization since your last shift, since your last visit and shift, the client was rehospitalized, you have to click yes or no. Yes, if they were rehospitalized, and no, if they were not rehospitalized. You have to click on that. And if you click yes, they were rehospitalized, you have to put a reason why they were rehospitalized. You have to put a reason. If no, you click on no. And then over here, and if the client was rehospitalized and you put your reason why the client was rehospitalized, let's say it was for pneumonia. If your client was rehospitalized for pneumonia, you click yes. And then you have to notify your supervisor, okay, that the client was rehospitalized for pneumonia. Okay, for example. All right, you got to put a reason. And then you got to document who you notified, the person's name, and you got to give a quick detail of who you notified. And then over here, you have to do your vital signs. Let's say your shift start either at 6 a.m. Or whenever you did your vital signs, whatever time you did your vital signs, okay? If you did it at 6:30 a.m., or if you did it at 8 a.m., if whatever time you did your vital signs, if you did it at 8, if you did your, whatever time you did your vital sign, then you put the route, the temperature, how did you get the vital sign? You know, temporal and everything, axillary. You document, let's say, whatever your vital sign is. Let's say it was 98.7. And if you did it, you know, forehead, you know, you put tympanic. If you did it axillary under the armpit, you put axillary, whatever, whichever one applies. And then your heart rate, it's either regular or irregular. Regular, and if you did it a radio one, or if you listen with your stethoscope, then it's apical when you listen with your stethoscope. And then you put what the heart rate was. Okay, let's say the heart rate is 85. You can put the heart rate is 85. Let's say the heart rate is 84. You put the heart rate is 84 or 87, whichever one applies. And if it's radio, it's regular. If your client normally have a regular heart rate, if your client normally has a regular heart rate, it's regular. Some clients, their heart rate is irregular. Some clients were born with an irregular heart rate or with a heart murmur. If it's irregular for your client, okay, if the heart rate is irregular, you document irregular. However, if you have a client, their heart rate is irregular and all of a sudden it's irregular, you have to continue to do your assessment. Continue to do your assessment. And if the heart rate remains irregular, then you have to notify the physician because this is not normal for your client. This is not part of their baseline. The only time you don't notify the physician of any changes in his medical condition is if it is something within the baseline of that client. Because like I said, some clients normally have irregular. If it's normal for your client, then you don't have to call the physician unless there are other vital signs that are indicating there are significant medical changes. Then you notify the physician. If it's always regular, all of a sudden it's irregular, and you continue to do your implementation and nursing intervention, and you are reassessing their vital sign, it remain irregular, and this is not normal for them, you got to notify your doctor, notify the client's physician, and to get possible orders, to get possible physician orders for the client or other recommendation. The same thing is for respiratory, okay? Normal respiration for an adult, it has to be more than 12, and it cannot be greater than 22. It's normally, a normal would be, 16 to 20, or at least 14 to no greater than 22. And then you have to know for each specific age range, whether your client is an adult, a teenager, young adult, a toddler, a newborn, an infant. You have to know what is normal, what is considered normal parameters in terms of all vital signs for temperature, heart rate, respiration, and then also their BP. And then if there's specific order for pulse ox, the doctor give you parameters for pulse ox, it cannot be less, let's say, than 94%. Your pulse ox should not be less than 94%. It has to be at least 94% to 100. If it's less than 94% and you continue to do your assessment and it remains less than 94%, then you have to notify the physician. And if it gets to a dangerous range and accept a range that is unacceptable, you know when to call 911 for the client if you're not able to stabilize your client. So you have to know which vital signs are within normal limits and which vital signs are not within normal limits for each age group, and when to call either 911 or when to call the physician so the physician can give you new possible orders or make other recommendation. Let's say if you have a client and the client is, let's say the client is more than, is about 18 years old or whichever. And then you're gonna tell me that their respiration is 25 or higher. That's not normal. That's not a normal respiration for that particular age group. So you have to know what are the ranges for each particular age group before you document it. Because if I see you document a vital sign that is not normal for that particular age group, depending on the age of the client, I will ask you to make the necessary corrections for in your notes. Okay, and then you got to document your BP. And let's say if BP is not applicable, there's no doctor's order, it's a BP optional. You don't have to take the BP for that particular client, then you can put not applicable. That tells any person, even an auditor who's reviewing your chart, anywhere the chart find itself, that it's not applicable because under service plan or the physician order, the PPOT, wherever the service plan for that particular client, it's a BP optional. If it's a toddler or an infant and you don't have to take their BP, not applicable. If the client refuse, you can put the client refuse. Okay. However, if on the physician order, it says you have to take a vital sign. You have to have your vital sign. Let's say you could put 112/76. Depending on the age group of your client, okay, that would be normal. Okay, and then let's say you have a good O2 sat. Let's say your O2 sat is good. There's nothing wrong with your O2 sat. Your O2 sat is 98% or even higher. That's normal. And let's say respiration is good. There's no issue with respiration. Okay, your respiration is good. Okay, let's say this is an adult. So everything look good, then we're good. And then you have to make sure if the respiration is regular or irregular. If you have a client, they are in respiratory distress and their respiration is irregular, and you document irregular, the client is wheezing, they have rales, bronchi, abnormal breath sounds. You have to document within the notes your interventions for the clients, all your nursing intervention, and you have to follow doctor's orders according to the care plan and the service plan. You got to give the proper medications, your proper intervention and treatments to stabilize the client. And if you're not able to stabilize a client because they are in any sort of respiratory distress and it's irregular, at that point, you know it's a life and life and death situation. You got to call 911 immediately. And you also know when you don't really have to call 911 at that time, even though the client may not be fully stabilized, you can call the doctor and the doctor can give you a recommendation. If it's a life and death situation, then that's a 911. That's a 911 call, okay? You know, by using your clinical skills, when to call the doctor and when to call 911. If you're not able to stabilize your patient in order to save a life, you know? As clinician, we got to do our best to save a life. That's what we are there for. Okay, and we got to document properly. Under the neuro section, you got to document if your patient is awake or is your patient asleep, is your patient oriented or not, are they verbal, can they speak, are they nonverbal, can they not speak, and are they alert to person, place, time, and situation. Let's say you have a patient who's only alert to person, and you can put alert time 1 to person. And if it's time 2, you can put if it's times 2, it's to person and place. You put alert and oriented times 2, and then you put what are they alert to person and place. Or person and time, if they are able to tell you time. Whatever else. Okay? Because some clients might be alert and oriented to person only, or they might be alert and oriented to person and place, or they might be alert to person, place, time, situation. Whatever is appropriate for your client, use your clinical skills to document if they are not fully alert and oriented times 4 to person, place, time, and situation. Your client can be nonverbal, however, they are trying to make words, they are trying to vocalize. You can put that your client is nonverbal. Your client is nonverbal and attempting to vocalize. Attempting to vocalize words. Okay, so anybody who's reading your chart know that this client is nonverbal. They're not able to really speak. However, they are doing their best to vocalize words. Okay, it might be a toddler. Okay, it might be a toddler. So they don't like, how can the client is nonverbal and they're trying to vocalize? If you put a detail here that they are trying to vocalize words, then whoever is reading your chart or wherever your chart finds itself, the chart will speak for itself without you even being there. Without you even being present, your documentation will speak for itself and there won't be any confusion, whoever pick up to read your chart. And then let's say the client has developmental delay and they have cognitive impairment. There's some impairment, you got to document that. If there is not, you don't document it. If there is, you document it. Okay, it's whatever applies for your client. Let's say this client is awake and this client is oriented to person. Okay, and this client is verbal. Okay, then however they're not fully oriented to like person, place, time, and situation, you put what they are oriented to person or place. Okay, whatever they are, and you can put ×1 or ×2, whatever, ×3, place, time, or we can put ×3, oriented to person, place, time. However, they're not oriented to situation. They might be oriented to person, place, and time. However, they cannot give you a full description of a situation or an event. So that's when they're not oriented to situation, then you don't put that. And then anybody who's reading your chart, and then if they are oriented ×4, then you can put oriented ×4. That's when they are completely alert and oriented to everything. Okay, there's no cognitive impairment. If you put somebody's oriented ×4, then you cannot put cognitive impairment. That would cause a discrepancy, and you cannot put developmental delay because you cannot be oriented to person, place, time, and situation and have that. That would be a discrepancy. So whatever applies to your client. And then if it's an infant, like a newborn, few months old, you know, they have frontanels. And their frontanels, if it's good, if it's not bulging and it's soft, it's not bulging. So that is good. Those are for newborns and that are like a few months old. If the frontanel is very sunken, something is wrong. It can be slightly sunken. However, it shouldn't be like, you know, anything that appears to you abnormal. Bulging, if it's bulging, it shouldn't be bulging either. If your client is not a newborn, the client is not a newborn, the client is a toddler, a young adult, or an adult or a teenager, you can put not assessed. The reason you didn't assess it is because they don't have no fontanelles. They don't have one for you to assess, okay? Because it's not a newborn or somebody who's a few months old. So you can put not assessed because there's not one for you to assess. There's no fontanelle. Everyone should have a reflex unless they are in a coma state. If they are comatose, if somebody is comatose, then they have no reflexes. If somebody is not comatose, in a coma state, they should have some kind of reflex. They should be able to blink. Sometimes they can even gag. Okay, they should have a hand grasp. Okay, some type of hand grabs or something. If they have any reflexes at all, you have to check on this, okay? You cannot put not assess. Or if they have reflexes, or let's say they are in a coma, or they don't have any reflexes at all. Let's say if the person is a quad, if the person is a quadriplegic and they're not able to move anything at all. If they're not able to put anything at all, you document that the patient is a quadriplegic. They're not able to move anything at all. And then you document why. And then you put with no reflexes or hand grasp. They have no reflexes or hand grasp. Okay. However, if they have some kind of reflexes, if they are able to blink, even if they can even blink, even if they don't have a hand grasp, they can blink. You have to put they're able to blink. Don't document not assist for reflexes. You can put reflexes. Uh, uh, the client is a quad, unable to assess any reflexes, no reflexes, no hand grabs, no nothing. You got to document something. Seizure activity, you can click yes or no. Did the client have a seizure during your shift? Even if it's not a seizure client, because anybody can have a seizure and epilepsy, and then it can become a new diagnosis for them. So even if it's not a client who has a seizure diagnosis or at risk for a seizure, you always have to document on this. Did the client have a seizure during your shift? Yes or no? Always document on this. And if they had a seizure, you got to document some details, whether they are lethargic or whatever. Let's say your client had a seizure and you document that the client had lethargy. You got to document whether it's mild lethargy. Mild lethargy, you don't have to do anything for. If it's moderate lethargy and your vital signs are abnormal and the client is not looking good to you, you have to either call the doctor after you ensure the patient's safety. During the seizure activity, you make sure the patient is safe. Post-ictal phase, you got to, assume the recovery position to make sure that your client doesn't aspirate on any saliva or emesis or vomiting or anything like that. You are ensuring your patient's safety, and then you are also calling the doctor, the physician, when it's necessary, when it's needed. You are calling your doctor, or if you have to call 911, depending on if it's a grand mal seizure. You will use your clinical skill to know when to either call the doctor, when not to call the doctor, when to call 911, when not to call 911, and how to stabilize your patient. Some patients have emergency medication in the home like diazepam. If there's an order to administer the diazepam, follow your physician's order, depending on the type of seizure it is, to administer the diazepam and try to stabilize your patient. Just use your clinical skills. If you document lethargy, I want to know if it's moderate, mild, or severe. If it's severe lethargy, this patient is getting to be comatose on you here. Okay, the patient is not responding. This is a 911 call. This is not even calling the doctor. This is a 911. If the lethargy is severe and they are almost in a coma state. Okay. And then that's where you can put your notes. When I say add to comments, that's mean in the comment details. And there's more comments here. You can even write more comments here, and you can write in details in here. And then if the client is cooperative, more cooperative, uncooperative, playful, whichever one is applied for your client. If it's other, you want to put more details, you can put here. Okay. And then if the client is cooperative, whatever you want to document, those are the comment sections, whatever apply for your client. When you are assessing is the client Perla, you know how to do your Perla skills. If it's not Perla, you don't click on Perla. And then you got to put, are the pupils reactive? Yes or no? or is it non-reactive, for both eyes? Okay, one can be reactive and one can be non-reactive. So you gotta click. If they are both reactive and you put reactive, is vision within normal limit? They don't have any blindness or impairments. You can put both of them are reactive. The cornea, if it's clear, you gotta indicate both. If you put the sclera is white, you cannot just click clear and white and then you leave everything blank, because it doesn't tell me or an auditor who's reviewing your chart or anyone who's reviewing your chart anything. You gotta let me know, is it both eyes? Okay. If you tell me it's clear, you gotta indicate which one, because one can be clear and another one can be jaundice. You know, you gotta indicate which one. And another one can be opaque, where it's not clear. So whichever one applies to your client, you cannot just click this and then you don't tell me if both of them are clear. And that if it's not within normal limit, if the client is blind or visually impaired, you can click on this. Okay, they are blind and visually impaired. Sometimes the client can be blind and visually impaired in their cornea and their sclera. When you're looking at it, when they open your eyes, it can be clear and white. You can click that. If it's jaundice, meaning yellow, if they have a liver condition, they are jaundice, you can document. If it's opaque or if there's hemorrhaging, you can document that. If they wear glasses, if they wear eyeglasses or contact lenses, you can document that. If they have glaucoma, cataracts, you can document that, whichever apply to your client. However, when you click on this here, you got to be more detail oriented and tell me, is it both eyes, or you document whichever apply. Don't just click this and leave this blank. You got to click whichever one applies here. Okay. Whichever one applies. Okay. Let's say you can click this one here and then you can tell me this is clear and then this one is opaque. Okay. That's the cornea. And you can tell me the sclera over here is white. However, this one is jaundice, or whichever applies. So you got to be detail oriented on that. And if the mouth is unremarkable, you can click on remarkable. If there were dentures, then you can put dentures. If it's other, let's say they have upper dentures, they don't have lower dentures, you can put upper dentures. Okay. Indicating they only have, one denture. Or if they have both, you can put upper and lower. Okay, because sometimes people have upper and lower dentures and sometimes people just have lower, whichever one applies, and it doesn't take a lot of time for you to do that. And if they don't have any dentures and they are unremarkable, you put unremarkable. Their face, if they are a stroke patient, you can tell me if their face is symmetrical or asymmetrical. Or if they have other medical diagnosis to cause their face to be asymmetrical, you put asymmetrical. If the face is symmetrical, you document symmetrical. If their ease is unremarkable, they are able to hear sounds, they are not deaf, then you can put unremarkable. If you are not sure, then you don't click on this. You can put response to sounds. Response to sound, if they are deaf and unimpaired, then you cannot click on remarkable if they are deaf and unimpaired. Okay, because you're going to create a discrepancy. And if they are deaf, and it can be one ear or it can be both ears. Okay, you just let me know. If they were hearing aids, you click on hearing aids. If it's only hearing aids for one ear, you just put one ear. That's when they can hear in the other ear. Okay, they have a shunt placement. You can document your shunt and that the shunt is palpable. For cardiovascular, you got to put the heart sound when you do your heart sound with your stethoscope or with radio, whichever one you do. The best one is with your stethoscope. You can put whether it's regular or irregular, and we already discussed sometimes irregular is normal for your client, where you don't always have to call the physician. If they were born with a heart murmur, you can put the heart murmur and any other details, you can document it. Okay, if that's normal for your client, then you don't have to call your doctor if it's within their baseline. If it's not within their baseline and you cannot stabilize the clients, either you will know when to call either the physician or to call 911. When they ask you, does the client have heart rate parameters? Do you have physician orders for parameters? If you don't have the physician order, you can put not applicable. Okay, for some client, they will tell you the heart rate cannot be more. The heart rate cannot be more than, let's say, 100. It cannot be higher than that, then the client will be tachycardic, okay? And it can not be lower than 60. You would put that's your parameters. Or if they tell you the heart rate cannot be lower than 160, whichever parameter the doctor gave you, or if it tells you 180, the highest it can be is this, the lowest it can be is that, then you have to document. If you don't have heart rate parameters for your client, then all you have to do is document not applicable. Okay, if you document not applicable, then anybody who picks up your chart knows that you don't have a physician orders for heart rate parameters. Okay, and then for your radial pulses, you have to assess either the radial brachial, and then it gives you ranges. When it's normal, it's +3. Okay, you document your +3 here, indicating it's normal. And then that's for both, indicating if you do your radial and you don't do the other ones, the X mark, meaning that you didn't assess them. You can just put, your X mark, meaning you didn't assess. That's what it means. Then you can put an X, okay? And it doesn't take a lot of time for you to do that. You just do that. And then you over here indicating you did the either the radial, brachial, and sometimes you can do all of them if you want to. You don't really have to. Okay, whichever one you did. However, you have to do, you have to assess peripheral pulses. Okay, you have to assess it. Okay, and +3 is strong. That's a good pulse. If you use a Doppler, you cannot get a pulse on your patient. You have to get an order for a Doppler. The doctor, if you cannot assess any one of these pulses, peripheral or pulses, they're not palpable, or you cannot assess them, then they have to do a Doppler. That's the +1. If the pulse is weak, you can barely palpate it, then you have to put this, a +2. If it's strong, if it's a good pulse, you put a +3. If it's bounding, you have a bounding pulse, that's not too good. You got to make sure that the patient is stabilized if they have a bounding pulse. Okay, it tells you what each one means when you put it in here. However, this part, you have to fill something out in this, in this. Okay. Capillary refill, you can put less than 3 seconds, which is good. If your capillary refill is greater than 3 seconds when you do it, you gotta put why, because that's abnormal. There's problem with circulation. If you're not able to assess a capillary refill on a client, you got to document why. You should never click not assess unless they don't have any limbs. They don't have any arms or legs. Let's say, because the capillary refill can only be done on your nails, If they don't have any limbs, legs, and feet, then you can click not assess because they are an amputee and you got to put the details. They are wearing prostheses, they have prosthetic limbs, then you're not able, that's the only time. However, you should be able to assess it. Or let's say if they have, if you're not able to assess it for any reason, you have to put a documentation why. And if they don't have any prosthetic limbs, something is happening and you need to call the physician because something is abnormal. then you have to call the physician. However, it is normal when you click less than 3 seconds and you gotta put like, right, whatever the location. Okay, you can put your location here, whether it's on the toe, whether it's on your the finger, whichever one, you can put it here. Okay, and then for edema, you have to document in here. Where did you get your capillary refill from? You gotta document this. And then if there's no edema, you click no edema. If there's edema, you gotta put where your edema is and you gotta identify where. And you gotta do your documentation here if there's edema. If there's no edema, you click no. If it's a non-pitting edema, if it's non-pitting, you document the side and you document detail because sometimes you'll have an edema and it's non-pitting. Okay, if you click yes, there's edema and it's non-pitting, it's mild, you got to do other documentation here. If it's no, you don't have to do anything. You get to the musculoskeletal. Musculoskeletal, those are if the client has missing limbs, like they are an amputee, they were prosthetic legs or whatever. If that does not apply to your client, then you leave this. You don't do anything here. You got to document the muscles of your client, whether it's hypertonic, hypotonic, or normal activity. If your client is hypotonic, they're going to be flaccid. You got to click which one is flaccid. You got to click whatever is pertain to your client. If they are hypertonic, they're going to be rigid, and sometimes they'll have spasm and tremors, and you got to document where. You got, be specific. Each client is different. Each case and each client is different. If it's normal activity, they're not flaccid, they're not rigid, they don't have spasms and tremors, they have normal activity, their range of motion is active. You can put it's active, they can do their own range of motion. And then some clinicians just document active and they don't put anything here. It's not really telling me anything. You got to document like this. It tells me this is normal and everything is good. If it's not, if you put, let's say, hypotonic and you put flaccid, you got to tell me where. And they can be hypotonic on one side and they are hypertonic on another side. And they have spasm somewhere. You got to click whichever, let's say for a stroke patient, you can have that. One part, the stroke, where you have the stroke can be, will be deformed. You have deformity on the affected side of the stroke and the other side is normal. So one side can be normal and another side can be, flaccid, where you have the paresis. So you got to document, take your time and know what this means and document properly. And you have to be consistent with your documentation. There has to be consistency. If the client is on ambulatory, able to walk on their own, you put ambulatory. If not, you put non-ambulatory. If they ambulate with assistance, let's say they use a wheelchair, cane, walker, whichever one, you click on that and you can put whether they are chair-bound, non-ambulatory. A client cannot be both bed-bound and chair-bound. If a client can sit in a chair, any chair, wheelchair, any chair whatsoever, even though they cannot walk, they are chair-bound. The only time a client is bed-bound is when they are non-ambulatory and they're not even able to tolerate sitting in a chair. If they cannot tolerate to sit in a chair, a wheelchair, or any chairs at all, even when you call 911, they have to be on a stretcher. They cannot be in a wheelchair. Then that's when they are bed-bound, is when they cannot sit at all. They cannot be both bed-bound and chair-bound. Okay? If they can be in a chair, and they can tolerate sitting in a chair on for a good time period, if they can sit in a chair for a decent time period, then they are chair-bound. Bed-bound only applies to someone who cannot sit in a chair at all. If they have any prosthetics or anything, you document here where it is. Okay, if they have any contractures, you document here. If they don't have any contractures, you don't document here. If they use assessive adaptive aids required, you document which one that they use. If they don't have any at all, you put not applicable. Okay. If they use wheelchair, you put wheelchair. If they have a stander, some patient will have a wheelchair, stander, and walker, meaning that they can walk or whatever. If it applies, whatever applies, and sometimes your patient will have a helmet, depending on the precaution that they are using, gait trainer, whatever your client is using. If your client has a Hoyer lift, you can document whether they are able, they won't be independent if they have that. Like, how many person has, it always, when you have a Hoyer lift for safety, it's always 2 people. Okay, for safety, if you document Hoyer lift. That's it for page 1 for today. Next time we will talk about proper documentation on Netsmart and Devereaux on page 2. Thank you for your time. And if you have any questions, you can always either send me a text or you can give me a call or send me a text. You don't have to tell me the client's name because of HIPAA.